that 10 out of 10 pain that you get when you're in a hurry, you're trying to get out of a house and you smash your first toe on the corner of the table? That acute excruciating pain is the pain that people with gout experience. My name is Dr. Arinola Dada. I'm a rheumatologist. I help people with joint pain who have concerns about long-term damage to their joint, preserve their joint function so that they can live an active life. So let's talk about gout. So why do people even get gout, right? So we get gout because our body is making too much uric acid. So when we eat proteins and foods with high fructose corn syrup, our body breaks this down into uric acid. Under normal circumstances, we can just excrete this uric acid out with no problems. But sometimes the kidneys can't handle that high uric acid load. So then the uric acid is not soluble and it tends to form crystals. And those crystals like the cold joint. So the farther the joint is from the heart, the cooler it is, and the more likely that the uric acid crystals will precipitate. And you can say, well, does that mean that my kidneys are not functioning? Well, no, your kidneys actually can be functioning just fine. But the problem is that it may be genetically determined that your kidneys cannot handle a certain load. In addition, women who are premenopausal, so before menopause, may not develop high uric acid levels or gout because they have estrogen, and estrogen increases the excretion of uric acid. So let me tell you a story. So when I was working at the VA, my vets would go during the weekend fishing, and they'll have platters full of shellfish and crab and wash it down with beer. And unfortunately, Monday morning was gout clinic. So as a rheumatologist, one of the most fulfilling things for me to treat is gout, because we can prevent attacks and we can protect your joints. So there are 5 things that I typically tell my patients about who have gout about how to protect themselves from acute attacks of gout. So number 1, just keep well hydrated. The better hydrated you are, the more likely you can just excrete these uric acid crystals out. Number 2, well, what are you eating, right? So if you're eating, so you want to avoid high, shellfish, things that are really packed with protein like organ meats. Well, what are you drinking? So beer is notorious for causing gout. So you want to avoid beer. So beer is more likely to cause gout than spirits, which are more likely to cause gout attacks than wine. So if you have an option of beer versus wine, then if you have gout, then wine is probably a better option. Now, I'm a doctor, I have to tell you that water is the best beverage, okay? Then weight. If you're overweight, then weight loss will certainly help with preventing gout attacks. And the other things, people ask about supplements. So vitamin C, dairy products, and even caffeine in some patients have been found to lower uric acid levels. So there are so many medications that can be used to treat gout. Anti-inflammatory medications, steroids, Cristexa, Uloric, allopurinol, Colchris have all been used to treat gout. Now, a word of caution, I have had patients who had self-medicated and treated themselves with just over-the-counter Aleve, ibuprofen, and have unfortunately damaged their kidneys. So you want to talk to your doctor about gout. Gout is so treatable. There is no reason why anybody should have attacks of gout that are untreated, or even lumps of tophi. Tophi are this huge amount of crystals that sometimes people have around their ears, elbows, and knees. We have medications that can take care of all that. So my name is Dr. Arinola Dada. Contact us at overlakearthritis.com. Like this video if you think it's helpful on Facebook, or share it. We will be happy to help you on your journey out of pain and towards healthy joints. Take care.